I welcome, I welcome you all to the third week of our mentorship program. And today, Professor Morenike Folayan will be taking us on history and impact of research. I ask all the fellows to listen attentively and follow the session. Questions will be asked during the course of the lecture, and ensure you name your device appropriately. Ma, you have the floor.
Thank you very much. Good morning, everyone. It's a pleasure to be here with you this morning. My lecture is extensive. I'm going to try and walk and see if I can stay within the 1 hour. But if I have to extend a little beyond that, please do accommodate my extra minute. I do this lecture with students with the University of Oxford. It's exactly the same notes I shared with you without the logo of the University of Oxford. So it's important to understand the history and how the history of research impacts our research. And that's to introduce us to the ethical considerations for research. You would find that once research is not guided, as human beings, we start to exploit. It's a normal phenomenon. Even with guidance, there's still exploitation. What we're hoping is that your cohort would not be found in any part of this negative history, but that you would learn from the history and make a difference in the kind of research you want to do. At the end of my lecture, the coordinator, Dr. Lawal, would also spend some time passing on some information would be useful going forward with your fellowship. I once again congratulate those of you that made it to the fellowship. And as much as possible, we want to see you ending as a team. So let's see how we can support ourselves and to make it to the end. So I'll be talking first about research strategies, and what has led to principles and codes and guidelines, and how those principles are applied in clinical research. And what is it that you do that would make your clinical research ethical? We would then look at guiding ethos. What are the things that you yourself must do to be morally praiseworthy when you're doing research? And then I'll share my closing thoughts. So first of all, let us look at examples of research strategies that led to the regulation of research. Before research wasn't regulated, it's very important for you to know that research is now regulated and how it is regulated so that you fall within the ambit of what is right. The things about ethics is about morally good and morally praiseworthy. When you start infringing on the rights of people, then it becomes legal issues and then it goes to law. When we talk about ethics, it's you as an individual that should self-regulate. And that's the limit. You don't go to court. People can take actions, but you need to self-regulate to ensure that we keep within the ambit of what is morally acceptable within research conduct. So what you're seeing up to now, and I'm sure some of you will share with us as we continue in this conversation, is that the history of human experimentation and has been fraught with controversy. Okay, and I'll be able to demonstrate that through the history I'm going to take you through. It is assumed that clinical trials started way back in 1747. I'm not sure it was a conscious effort to do clinical trials. It wasn't named clinical trials. But what this guy did then can otherwise be regarded as a clinical trial in 1747. What did he do? In that time, I'm sure you must have heard about the issues about scurvy. And it was he that demonstrated clearly that the taking of fruits, otherwise now understood as vitamin C, would cure scurvy. He had 12 of his sailors and he gave different interventions to them. And then he found that the taking of fruits was a treatment for scurvy. So it was about observation, thinking, critical thinking. He didn't have records. He had to think innovatively. He had to address the problem of his sailors. Okay? And he found the answer, and that made a difference. So if there's anything I want you to take out of the slide, it's about the critical thinking that involves solutions to problems. You do know research is about solutions to problems. You have a gap. You want to solve a problem. But it takes critical thinking for you to look at how do I resolve this? and innovations come. And you get beautiful answers that will be translated into impact. Even further on in 1841, there were people that did things like careful examination. I was still sharing this with others that research questions are generated by observation of things around you. That's how you generate a research question. It's not by, of course, reading extent. Once you have observed things around you, you then read extensively to know if there's knowledge gap or not. And this was what Ignaz did in 1841 to 1846. He noticed that there was a difference in the rate of death between two clinics based on fever. And then he started looking at the variables and saw that there's a clinic that was run by obstetricians and there was a clinic run by midwives. And he saw that, okay, what is it that they do differently? And then he found out that's the washing of hands, simple. Obstetricians washed hands before they take their bath. Midwives didn't wash. And that alone was able to show that difference. Then he went on further to look. By 1847, he was able to establish that the use of chlorinated lime to sterilize the obstetrician's hand reduced the rate of puerperal fever by observation. And I'm sure many of you would also reflect in history how observations have led to things. Even HIV, it was observation that showed, wow, there's a group of people coming down with pneumonia. And then they started to observe, Even for us in dentistry, it was observation. They noticed that, some people living in some area come out with mortal teeth. And that was how we got fluoridation, and it's still useful for us today. The power of observation. You must develop it yourself. If you notice, one of the critical differences between we Africans and Europeans is observation. If you walk in front of an European, within a twinkle of an eye, if they tell him to describe, you would describe it with precision. And that's how they do a lot and get a lot of criminals arrested. Me and you can sit in a bus and they tell you, who was your neighbor? And you know what? Most Africans, 80% of us cannot describe the person we sat beside for 1 hour. The power of observation. You must develop that for you to be a good researcher. With observation, you can then develop research questions that have life impact, social impact, and then you can make a difference. So you can say Ignaz just by observation. When first of all identified there was a difference in bathways, and then because he studied further, he was not able to generate the fact that chlorinated lime used by obstetricians to sterilize their hands before taking children's bath made a difference in the bath rate. Now let's go further. And one of the things you must notice, please notice the years. I started with 1747, I went on to 1841, now I'm at 1897, which showed that research had started ages before. By 1897, they started to look at more formal ways of experimentation. And Sanarella, by 1897, said he was able to discover the cause of yellow fever. And that was because he was able to reproduce yellow fever in 5 patients. However, public outcry had started by 1898. For him to have discovered yellow fever, he injected various organisms into people to see if it will establish the fever. And Osler then condemned that action publicly and said, by deliberately injecting poison, because there was no cure to yellow fever. So now that you've produced yellow fever in 5 people, in the name of discovering the organism, you've infected 5 people with yellow fever. It's going to live with the consequences for the rest of their lives. And so it came up and said, deliberately injecting a poison with high virulence as high as yellow fever in human beings without obtaining the consent of that person is criminal. And that was when you started to evolve the thinking around ethics. And you see what it meant. In 1990, remember I'm making progress from 1847, the Congress in US raised the Senate Bill 3424, which was a law that required that every investigator must screen beforehand the purpose of their procedures involving human beings. And that was where the need for a protocol started. And protocol that needs to be evaluated and given approval before you can do studies in humans. That was when it started. Okay, so before that, you just do things in your corner. And the bill actually banned for experimentations on people who were unable to give consent: infants, pregnant persons, people under the age of 21. Sadly, this kind of thinking had gone on until now, and there's a new wave that is starting to ask for different in approach. Because when you're pregnant, they say, oh, the fetus. And so you're finding that people that are pregnant are not recruited into studies, yet they will use the drugs that did not study its impact in their life. And this is not the way to go. It was this bill that caused that kind of difference. Also in infants, we find out we don't do clinical trials in infants. What happens is that you do clinical trials of a drug in adults, and then you say cut the pills into half or cut it into a quarter for infants without doing direct studies with infants to know what is appropriate for their age. So these are things that we're starting to look for to change now. But this bill 3424 evolved in a bid to address the abuse of people. And believe me, the yellow fever is just one of many. Even the yellow fever studies, there were studies that were given and people were given gold, but you infect them. Quite a number. Please know that this is an abridged. If I'm going to go through the history, I'll take you three hours. This is just an abridged version of what we're doing. By 1938, regulation had also come that drugs and cosmetics, before they even come into the market, they must be tested for toxicity. You just don't wake up. In those days, they will go around, like the things that we see in buses in Lagos, where people would take drugs in their baskets, all kinds of drugs, and they're selling across the states. That's what it used to be in those days in the US and the UK. US is known as the father of ethics. Ethics actually grew out of US. America. So ethics is very well grounded in America. It's just a lot more moving around the world. And I can assure you that it's more grounded in Nigeria than it is in some European countries. So with evolution and the need to control the things that people take in, the Food and Drug Cosmetic Act 1938 was passed, that all drugs or cosmetics needed to be tested for their toxicity before they came into the market, and there must be directions on the package on how to use, and that some drugs can be prescription only, some drugs can then be bought over the counter. But after this, we saw the issue about the Nazi experimentation, where people took prisoners and felt that, rather than they dying, let us use prisoners and experiment on them. And these experimentations were all awful. So you have the Germans taking Jew prisoners, you could drop them in ice water, say how long can they survive under ice water. You put them in heat, how long do they survive in heat before they die. You inject poisons into them and see, let me see the life course of this poison. So, this kind of thing started to happen. And in 1946, 23 Nazi medical personnel were prosecuted. I usually bring up the slide and I say, look at it. Please read between the lines. 23 Nazi medical professionals. They were not devils. They were not cleaners. They were medical people who had taken the oath not to harm people. Check it. They didn't have red hairs and 5 horns. They were medical professionals. Medical professionals. What got them lost? What made them inhuman? I can answer that one or two. When you run after data, it's a normal thing. Even till now, it happens. When you run after data without regulation, you will become inhuman. Because you will now continue to use human beings as a means to your end rather than human beings being an end in themselves. You will disrespect human beings, and your focus is about the data you generate. And this was the beginning of a change again in the way ethics research was regulated and ethics committees came in. What happened with these people in Nazi? Nazi people were also preparing for after the war, where they would then hold, positions of importance, Surgeon General, high importance. And so they wanted to get, run after the papers, the number of papers, publication that was life impacted because it to put them in positions after the war. And in running after that data, they lost the humanness of their research. And it was all about data. And believe me, it still happens. It's a normal thing. Once you're a researcher, what is of importance to you is data. It takes every other thing to bring the humanness into the people from whom you generate the data. And those are the kind of experimentations that happened during the Nazi war. We're looking at survivors' time after parachuting into cold water in Northern Atlantic, or immersing people in ice water. You immerse them, how long does it take them to die? People are kept outside without clothes, without shelter, at suboptimal temperature for 12 to 14 hours, and see what happens to their body. How does the body blood flow go? Or you freeze prisoners with cold water. You feed them with only salt water. What happens to their blood pressure? What happens to their parameter? Or no attempt to relieve victims of their pain and suffering that's caused by this experiment, because you justified it that they are prisoners of war. Rather than dying, they are helping you to generate knowledge. Okay. Other experimentation include gun to determine some effective ways of treating gun wound, burns, traumatic amputation, and chemical or biological agent exposure. So you inflict this wound, you shoot them, and then say, what way to treat them? What happens? What is the result of this gun wound? How does it shatter the bone? In what direction? You stab, you purposefully inflict just to see what happens. Okay? And so it led to concerns about the use of prisoners in research, as research participants. And following the trial in 1946 to the Nuremberg trial in 1946 to 1949, it took that 3 years. And medical people were incriminated. The Nuremberg Code was formulated, and we'll talk about it. One of the things you will see with the Nazi war crime is the use of people that had no power for themselves. And it continues to manifest itself even in recent days in various ways. The northern researchers in the global north come to use you in the global south because of the power that finance has. Without you being conscious, you open up the doors, citizens in your country, to exploitation in the name of $2,000 every month. And I tell you, if you're not conscious and you do not take this lecture, you will fall prey. Many of your colleagues, when you leave, or maybe people like you, when you leave, you do a PhD, you will take our samples. You take our body samples, our blood fluid, our data, without checking what it is, away to the northern hemisphere and leave it there. And these people continue to drag and get information for 20, 25 years with the data that you took away, and you took a PhD in 3 years or a master's in 2 years. You, as researchers in global north, south, continue to open the door for exploitation of people. It's the same thing also with you. You never go to experiment with people with less power, just for your good. So, for example, the prisoners, if you look at the studies we were talking about, they generate information for the good of others, not necessarily the good of the prisoners. So you don't use people in research. We never use people. I cringe when I hear the word I'm using. Why would you use people? You should engage people to be involved in research, and that's where informed consent comes in. You can't force people to participate in research. If they don't want to participate, they have a right to opt out at any time. That's their right. Okay, don't use people and don't force people. I'll tell you about little ways where we force people unethically to be involved in research. So the Nuremberg Code was 10 short regulations stating voluntary consent is absolutely essential in any research. And please know, when we say voluntary consent, it means people are not coerced. And there are very little ways where you coerce people. And it's consent. Consent means that it's either there's a way you document it. There's a legal process to it. Okay? So voluntary, for example, I tell people in Nigeria, I'm a lecturer. I'm teaching child dental health. I, as a lecturer, I take my students' attendance also, because student attendance affects their sitting for exams. So I stand as a lecturer and I come and administer questionnaire in the class, and so it's voluntary. It's only those of you that you don't have to all participate. Of course, that's a soft coercion. How will they not participate when me, their lecturer, Professor Oplong, stands before them? Who is there to say they would not fill the questionnaire when I would know the attendance and I know the 19 people that is in class and I only got 18 responses? Okay, so that's soft coercion. Or you're a medical doctor. You say, oh, it's voluntary. And then you ask your patient to participate in a trial. This is going to say, he's not going to say he's not going to participate. When in his head, he feels that not participating might mean sub-quality care for him or her. You, the doctor, that is going to come every week to see, then I say I'm not participating. It's very unlikely you would not say. Those are soft coercion. So these are the things you must write, and people must investigate to be sure that truly your consenting is voluntary. Okay. The other things that the Nuremberg Code also included was the fact that studies has to be conducted by competent investigators, and the investigators have the duty and responsibility to ensure quality consent. You just don't ask people to sign consent for, but they must have understood what they have subscribed to and have chosen based on understanding to participate in that research. There's a lot to the ethics governing research. What you're just listening to this morning is a very short brief. Participants will also have the liberty to withdraw from research at any time. This is one of the things I continue to see, although people say it. When you develop a questionnaire, that all the responses must be answered to before you begin. It's not voluntary again. You're forcing people to answer all questions. So you can't go to the next page except you answer a question. I say that's unethical. Ethics says that it's voluntary participation, which means if there are questions I don't want to answer, I don't want to answer them. And when you're forcing participants, I don't do those questionnaires. When I see it's forced, I just get out. Because there are some questions I don't want to answer to. But I can't move to the next page because I have to answer that. And so what happens? You're going to get people telling you false answers because I didn't want to answer it. Now you're forcing. So I didn't want you to have that information. That's why I want to skip it. Now you're forcing me to respond. I'm going to give you a wrong answer. And then I look at people when I read manuscripts and they say respondent rate is 100%. It's a lie. It never happens anywhere in the world except you force people to respond. And once you do that, you're already compromising the integrity of your data because people would respond otherwise. And you must really have nice people who decide to finish. I don't. I just withdraw from the research. So all those codes and regulations that you have around the world is intended to assure researchers that research on human participants is conducted in an ethical manner. But then, remember, this is Nuremberg in 1946. By 1960, we had the thalidomide crisis. With the thalidomide crisis, we had 83 children born with unusual birth defects. And then German scientists could connect it to thalidomide use. What was thalidomide? Thalidomide was used to prevent nausea in pregnancy. So you found out that mothers that took it in the first trimester came out to children with birth defects, especially with the limbs. What was the problem of thalidomide? Thalidomide was not prescribed for use for nausea in pregnancy. It wasn't. It was a secondary alternative use. However, there was no clinical experimentation on the alternative use of these medications. And we see many of such things happen where people are having alternative use of medications without clinical evidence supporting the alternative use. And then it becomes a problem because if they had done a clinical trial supporting the alternative use, they would have seen this birth defect in the few participants very early and stopped it. But thalidomide was used widely, and up to today, we're still seeing many of these children that came out as a result of birth defects resulting from thalidomide. Okay, and that also led to another law that was amended by the Federal Drug Agency in America, that's the name, that's asked and demanded for scientific data to provide evidence that drug works before it is used in humans. So you cannot just wake up and say, oh, based on my experience, Panadol, I know Panadol can cure glaucoma. You can't do that. You will go to jail straight. If somebody comes and they use Panadol and they go blind. Okay, just that our people do not know their rights. Yeah. But there must be evidence before you use a drug to do what it says it should do, or you use a drug that has alternative use. And that's why many pharmaceuticals continue to go to law, have cases in the court of law up to today. And then by 1966, we started to have the issue about animal welfare and animal rights. And this is really, there's so much in the market, in the public space now about animal welfare. And it's very well regulated when it comes to research using animals. At this point in time, what I want to make clear is that despite all the regulations, there's still questionable research done by researchers like you and I. And Henry Batcher did an examination, who's a professor of anesthesia, showed 22 examples of questionable research being conducted. Not only is it conducted, it was published in top-rated journals, top journals in the world. What was he able to show? He showed that mentally retarded and delinquent children were still used for studies, used without consenting. And these are vulnerable, HIV the least vulnerable people, very elderly, soldiers in armies being conscribed into research because they can't say no to their top officials, people who need it, terminally ill, alcoholics, children, patients on NIH clinical centers. These are people that are vulnerable. If there's anything is demonstrated, and you know that. If you call out for a child researcher and says, oh, I will give you a transport fee of 5,000, even me, my lecturer, I will queue for you. Because I'm vulnerable to being poor. And therefore you expect, or you want to do a research. I'm going into Lagos. I don't know if there's anybody that knows Lagos. You want to do a research. You go and recruit in Makoko or Ajegunle. You won't go to recruit in Victoria Island. Because you know that if you go to Ajegunle, in one day you have collected the study sample of 10,000 people. They will queue for your 5,000 reimbursement. If you go to Victoria Island, if you bring 20,000, they won't open their door. But the research you're going to use would only benefit those in Victoria Island. That's exploitation. And we still continue to do it today. You find out in the medical clinics, you want to do research to look at the relationship between chest X-ray and malaria. You know that normally your patients with malaria that come into the clinic will not take chest X-ray. But because you're a researcher and you have power, you will write in their list of investigation chest X-ray. Then they will pay for chest X-ray for your investigation that you will do. It's exploitation. You're making them pay for your research. Whereas there's nothing. And then you tell them to come Monday, Tuesday, Wednesday, Thursday. Whereas ideally they should come on day 1 and then come on day 5 for review. You would make them come every day. Whereas is your investigation. It's still exploitation because you are a doctor and the patient is the weakest in this environment. The patient is the weaker to the doctor. We continue to exploit. It's all over the place. It smells around us. We continue to do it. And these are unethical things. They can't shout. They don't even know that what you are doing is wrong. That you're exploiting them. So we need to have whistleblowers. These were the journals, top journals, where this guy, Henry Batcher, found exploitations. JAMA, Lancet, Cancer. These are Q1, top 1% journals of the world, where publications that show that people were exploited with. What are we saying? Even top researchers around the world can exploit. And once again, what is it? It's the need and the drive for data and publication and power. The story is told at the Willowbrook State School. What happened there was that in Willowbrook, these are children that are mentally retarded. And because of that, the house was poor, very poor. People, children, stool around the floor, they walk in their poo-poo, not properly packed. And so these children come down with hepatitis. And so this person wanted to study hepatitis, and he built a clean part of this house. And he said, for you to come to this clean part that is properly cared for by nurses, you have to consent to experimentation. Tell me, my brothers and sisters here, which mother would not want their mentally retarded child to be properly taken care of when going to a clean house free just by experimentation? But you know what the experimentation was? They purposefully injected hepatitis into these children and see the life history if it to be established. That was the experiment they did. So I wanted to look at the natural history of hepatitis towards working towards the development of a vaccine, and that was Dr. Samuel Kruger. So newly admitted patients whose parents gave consent for them to move into those homes were injected with hepatitis, or it was put in their milkshakes to see how hepatitis would be established with them. But you know, the sad thing about many of this awful story is that it will affect our future. Sometime in the future, they always dig up the stories, and you continue to see it when it matters most. For example, the president of Harvard, the first female Black president of Harvard, what happened? She was pulled down because she had a history of plagiarism. When she was not president, nobody pulled that down. But when it is all these things, when it gets exposed, it's journalists, investigative journalists that get them. And so they got Kruger. And Kruger, at the top of his career, he kept defending, it was consent, it was not coercion. However, the study helped to generate, because one of the things that also mattered was at that time, there was gamma globulin that could be given to cure hepatitis, but he withheld it in the name of looking at the natural history. Another thing you must know about unethical trials is that you can never withhold treatment. Once there's treatment, if there's no treatment, you can be comparing. If this one works, okay, there's no treatment for headache. Does Effa water work compared to OAU water compared to sewage water? But once there's treatment, you must never withhold treatment that is known to anybody. Okay? And then you can compare sewage water compared to Panadol, OAU water compared to Badama, and your comparison is talking about inferiority on superiority or non-inferiority designs. You must never. And we'll talk about another example somewhere below. Because first of all, your participants are human beings. They're not data. They have faces. They have families. They are human beings. You must respect people for human beings. Research is about dealing with human beings. You can't bring racism into human beings, into experiment. You can't start looking at black and white, Hausa and Igbo. I hate sex workers. And then you bring bias. No. Bring bias studies based on your sentiments. No. It's about human beings, and human beings in experimentation have equal rights. There is no inferiority about human beings in research. This is ethics. They have equal rights, whoever they are, white or black, yellow or green, male or female, Yoruba or Igbo, they have equal rights, and you must treat them as that. Objectively, kind, passionate, respect. And we'll talk about this as we go forward. There's also this history about the Jewish chronic disease hospital case where liver cancer was injected into elderly persons without consent to see if it will establish cancer. And what's the excuse? You do not want to stir up any unnecessary anxiety in patients who had phobia and ignorance about cancer. So they were tested if liver cancer cells, if you inject it in elderly, would they have liver cancer? And of course, many of you might know the story of the syphilis story in America, where people were recruited, Black Americans were recruited for years, and they were studying the natural history of syphilis. When they started the experimentation before penicillin came, they made every effort that these people that were recruited should not have access to penicillin, because you are studying the natural history. Until today in America, Blacks reluctantly get engaged in research because of exploitation. But the big thing about this study in Guatemala was that it's not unlike the Americans, where the US study went on for 40 years, studying the natural history, 40 years. In Guatemala, which is a country in South America, the Americans actually infected people with syphilis. And it was only discovered in 2011 by an archaeologist who was looking at the letters. I met a woman in Harvard, the woman that discovered. They were just, archaeology people, they'll be looking at history. It was the letters of correspondence of researchers that they noticed that this study happened in Guatemala, and they only infected people. And believe me, these were NIH researchers. These are not researchers that don't know anything. They are medical researchers under getting money paid by the US government. All the secret research that you have documentation. The one in the US was called the Tuskegee study. Okay, go and read about it. So what am I saying here? The fact that the top researcher is inviting you to participate in research doesn't mean you should not shine your eyes and read the protocol properly. Once you see evidence of exploitation, you whistle blow. And many of us get carried away by these things. There's abuse all the time. And it was based on this abuse that the 1974 National Research Act was created. The National Commission got together to study the moral issues involved in human experimentation, and a new regulation was emerged that no research should be done without ethics approval. Institutional review boards must review and ensure that the scientific integrity and ethical validity, scientific validity and ethical integrity for that study. You can pass science and fail ethics, but when you fail science, you cannot pass ethics. I repeat, you can pass the science of your research, but you can fail ethics. But you can never fail science and pass ethics. So it's very important to look at the two together. So institutional review boards now provide oversight for the implementation of research before and during the conduct of research. So please note that there are 3 phases of research: before the research, during the research, and after the research. The institutional review boards will give you ethics clearance before you start the research. While you're conducting the research, they would follow up and ensure that during the research it is conducted. Once you have finished the research and you want to publish, the peer reviewer has become the 3rd person to review your protocol. So every part of your research, there's an overview process. Before the research is the institutional review boards, your ethics committee. During the research is your ethics committee. After your research is the peer reviewers. Okay, so that whatever comes out finally to the public has gone through extensive scrutiny. That group came out with the Belmont Report, and the Belmont Report has 3 ethics guidelines: respect for persons, beneficence, and otherwise. The flip part is the non-maleficence and justice. So some people might say 4: respect for persons, beneficence, non-maleficence, and justice. And what does this mean? Everywhere in the world, these principles uphold, whether you are Japanese or black or white or green or yellow or Iceland man or Ubuntu man, these 4 principles uphold. Before I go into the 4 principles or the details of the principles, I want us to pause and reflect on what you have learned so far. What you must have heard so far is that regulations can exist, but it does not cover unethical behaviors. Which means for every one of you in this group, you must reflect on yourself and know that you are not the kind of person that is always wanting to cut corners. Because once you're a person that wants to cut corners, whether regulations exist or not, you will try to cut corner of the regulation. Regulation helps us to keep in order. But if you are not an ethical person, you would not follow regulations. You can see where I've started, 1747. And this is today. For me, 1974 is not far. For you, maybe they've just given back to you. But if you look at your school today and look at the research that you are seeing your colleagues or your senior colleagues conduct, you would see many of the things we are talking about, regulation does not cover unethical behaviors. You have to choose. You have to choose to be ethical in your conduct. The second thing you would have noticed is that you may need people to enforce regulations to make it work. And therefore, ethics committee has been put in place. If you don't have ethics committee, then do the right thing. Go to ethics committees where they are. Just do the right thing. But the fact that there are people to regulate doesn't mean people are not breaking rules. For example, in my own university, there's so many PhD studies that are going on without ethics clearance. I can, if it's possible that somebody has died over and over again, I'm sure I'm one person that would have died 101 times. They don't understand it. Abuse of participants and must just go on anyhow. Especially in a country where corruption is legal. You are corrupt people. Corruption is a normal thing. Your wisdom is not to be caught. When you are caught, they say, go sharp. This person is not sharp. They caught him. Not that what he did is wrong. In such an environment, unethical behaviors, including the way you handle study participants, will be high. Finally, please know that ethical behavior is not inborn. You have to learn to be ethical in your behavior. And this is part of the fundamental things we are teaching. You're going to be with us for over 24 weeks. We can't afford that everything you're doing in research from this group of fellows must be found to be ethical. Everything you do must be found to be ethical. We can't afford unethical behaviors. All right, so I hope you have learned this lesson up to this point before we go further. And see, there are guidelines. This is just a few. There are hundreds of guidelines. That doesn't stop people from being unethical. There are professional guidelines, there are disease-specific guidelines, there's Helsinki, there's SIOMS, there are guidelines, there are ethics guidelines all over the place. It doesn't mean people will be ethical. You must. Nigeria itself has its own regulation. So when we're looking at these principles, how do you apply it to your research? Each of you are going to conduct the research under the supervision of your mentor. And we are hoping that you will develop your research proposal and submit it to one of those calls that are having grants before July. But you must know principles that are involved in the design of your research. In your introduction, you will have to summarize what exists in the field, and you must find a gap and justify why a gap. Justify on why you want to address a gap in your study and why that gap is important, or what social value is that gap. Any research you want to do must have social value. It must have social value. You don't just do research because of research's sake. More recently, I met some few people, some of my students who were interested and just want to do research. I said, look, I can't do it. I don't mean that other people will not do it too. Other people can do it, but I can't. Because the time, effort, funds, the alternative use of time of your participant can be used to do something that answers a true research question. Don't waste people's time because you want to practice how you want to do research. Don't waste people's money, including your money. Resources are finite. You can't waste it. You must do things that have outcomes. And once you do this, we're respecting the principle of beneficence. Remember the 4 principles or the 3 principles from Belmont. When you design a study objective, it has to be smart, specific, it has to be clear, measurable, appropriate, which ensures that your study design and the instruments you use, your methodology are reliable. There's a time period, a smart objective. When you design your study in a way that you have a smart objective, then you're respecting the principle of beneficence. Your study design also has to be appropriate for the study objective. A wrong design is an unethical thing. Remember I said there's no wrong science that can be ethical. It's a waste of resources. You start study and at the end of the day, it cannot be published. Nobody can touch it. You've wasted time, you've wasted money, you've wasted, resources, equipment, funds. And a wrong study design, if you force it to be published, like people that go to predator journals, where anything goes, the result of a wrong design study will cause harm because it cannot produce truth. Your data generated cannot be truth. And if anybody depends on it, it will cause harm. And therefore, your study designs done properly is respecting the principles of non-maleficence. your study participants must be chosen carefully. Your study participants, you have to look at your inclusion criteria and your exclusion criteria. When you think of exclusion criteria, you want to eliminate confounders and mitigate harm. You must justify your inclusion and your exclusion, including your study site. I want to do a study in Ile-Ife. Why not Ilesha? Why not Kano? You must justify why you are doing it where you are doing it. And you cannot just exclude people because you want to exclude. I want you to study contraceptive use, and then I recruit 18 and above. Whereas in Nigeria, you know that by 9 years old, people are married. You know by 11, people are married. But you're not going to recruit 11. Even the demographic and our DHS, demographic health survey, shows that by 16 years in Nigeria, people have given birth to babies. We know even younger people do. But now you want to do your own contraceptive study from 18. What's the justification? Oh, I cannot be, because if I have to do younger than 18, I have to be collecting assent for, and that's a lot of problem. What? In a science that wants to generate objective results that is going to be applicable for people, in Nigeria, you would not recruit 16, 15 because of the wahala. There's no justification for you excluding people below 18. Because you know that the result of that study they will apply to them. But yet you did not recruit them to look at what it is that is of peculiarity to them. So unlawful exclusion disrespects the principle of justice. The harm and the benefits of research must be equally distributed. Okay, you don't go to recruit people in Ajegule. At the end of the day, it's people in Victoria Land that will use the results. You don't participate in a research where they recruit people in Nigeria, whereas at the end of the day, the study results will be used in America. And I can tell you many and one studies that have done that. I can even tell you the ones that have been involved in internationally and fought and made a change for the people in Nigeria. Okay? So you mustn't be part of those that are seen to be exploiting. Your sample size must be calculated. Please note that your sample size allows you to make appropriate deductions, because a sample is just a fragment of the target population. So you must be able to testify that this sample I chose is representative of the sample. And what we calculate, please note, is this maximum sample size. What you have heard is that research, one thing you must know, that research is harm. It's either minimum, moderate, or severe, but there's no research whatsoever that is free of harm. There is none, it doesn't exist. There's harm. It's just as much as possible. Everybody minimizes the harm there is. Everybody has an alternative use of time. I want to talk about the sleeping. So why would you recruit one extra participant when you can generate data with 100? So if my sample size says 100, I would tell the story. Why should I recruit 101 when I am exposing one person to harm unnecessarily, when that data would not add value to my study participants, to my study? So your sample size is your maximum, and your maximum sample size can only be increased by 20%. That's what is justifiable. Your sample size is 100 and you want to recruit 1,000 persons. And when I study that, I won't review that kind of protocol. Why? When your 100 participants will give you the answer, you now expose unduly 900 people to harm that does not add value to your sample size. And when you increase your sample size unduly, you introduce the type alpha error also. Kudus, you want me to answer this one? There's I think it's alpha error that you introduce because everything will become significant when they are not. So your sample size is very important to respect the principle of non-maleficence. Your study procedure must be properly described. Okay, the procedure must be so that it does not infringe on the rights of participants. The procedure should ensure appropriate sampling, because your appropriate sampling addresses the principle of justice. You do not unnecessarily leave people that should be in the study behind, or you recruit people that it is easy for you to get, and then the answer of the study is addressing people that needs it, that can afford it. You must use appropriate sampling size. When you are doing procedures, you must use the least invasive procedures, including your questionnaires. Please don't think your questionnaires are not invasive. I can tell you there are invasive procedures. For example, a colleague has shared with us before. You have a questionnaire. You go to widows and you say, oh, widows, when was the last time you had sexual intercourse? And at your sexual intercourse, you start asking questions that makes these widows remember they lost their husband. And then they start crying. They start crying because they answered your questions. Or you go and do a study on abortion and you're reminding them of an abortion they did not even want to do. And maybe they have done it, they can't even find babies anymore. Your questionnaire can be invasive. And that is why they said you must submit it so that they can study it. A social scientist has an expertise to be able to ask the same question in a way that is not invasive. So you must use the least invasive words in terms of words, in terms of procedures. If using, there's a new tool that can allow you to take blood samples without costing anybody pain, use it. Use it. Don't manage things with researchers. That's why you go for grants. You cannot do a proper research without getting good quality money. Ensure that whatever is, remember that every research, there's a risk. There's a risk. Or mitigate the risk, minimize the risk. If you're going to give somebody an injection, there's a risk of injection abscess. Mitigate the risk. If you're going to take questionnaires, you are using alternative time. That person might go and sleep. Only ask your research questions that are important, that you're going to use. Don't start asking 1,000 questions when at the end of the day for your research, you're going to use 3 questions. Mitigate the risk. And ensure you adhere to the laws. If you have to report anything, if in your research you find a pedophilia, you have to report. Adhere to laws. Respect the norms and traditions of people. If in northern Nigeria, males cannot do a vaginal examination for a female, then your research group in the north going for women must be women. Respect communities and the laws and the norms. And please be respectful of people. Use appropriate consenting procedures that shows respect for whoever it is that you recruit into your research. Your study instruments must be attached to your ethics clearance when you want to use it, and it must be tested for cultural appropriateness. It must be sure that it's a reliable tool, ensuring construct and content validation. You use appropriate language, because your appropriate language facilitates the disclosure. I hope you know that when we are doing research, we're seeking for the ultimate truth. We're seeking for truth. So you must do everything to allow us to do truth. For example, you go and ask adolescents, have you done abortion before? I've done that kind of research. So you're not going to get answer. No, nobody is going to tell you I did abortion because you didn't use an appropriate language that allows us to facilitate disclosure. If you use appropriate language, you will see that people will tell you I done abortion. So you must use, and you must take time to develop these instruments. You can't wake up and develop an instrument and go and administer it. Tools exist. Go and use an existing tool by adopting it or adapting it appropriately. If you're developing a tool, you must do construct validation, content validation, reliability at the minimum. Okay? And develop tools that will address your objective, not just going way around. By doing this, you are respecting the principle of non-maleficence. Your data analysis also, and please, I know that I'm only speaking on quantitative, must follow principles. Provide your independent variable, outcome variable, dependent variable. Explain explicitly what you want to do. A data analysis plan is not 2 lines. I'm going to do statistical analysis using IBS's version something, and my p-value is 0.05. That's nonsense. You must put it out, black and white, what you want to do. What are your dependent variables? What are your independent variables? What tools are you going to use for your univariate, your bivariate, your inferential analysis? You must name the statistical tools. If you're going to do inferential analysis, how was your models developed? And the review of this data analysis ensures that everything that otherwise should be addressed in the research objectives is addressed. And this way you respect the principle of justice. And then at the end of it, once you're published and you've done your research, please note that you must disseminate. It's unethical not to disseminate. It's not me saying it. Please go and read the research books. Read Stuart Ruth and Sink is there. It's not me saying it. It's unethical not to disseminate because you're wasting resources. You spent all this time and effort to generate data and then you put it on the shelf. Haba. The people who wants to find answers, you've already found an answer. They will assume that it has not been found. They will go and generate resources again. And then start the research because they want to find the truth that gets us to the ultimate truth. So you are delaying finding that truth via, there be an assumption, you've done 12 months. It takes another 3 years. When they do the analysis, they will find that there's a research gap because your results is not accessible. So it's not part of findings. So it continues to be a gap. And then somebody will have to do the research again, then wait another 2 years before the result comes. It's not right. And dissemination must be through multiple medias. And when you do this, you are respecting the principle of justice. When you also write your ethics approval, you must put a budget, which allows us to know that the research is truly resourced. If it's not truly resourced, you're going to exploit the rights of study participants. That's when you go and tell somebody who has malaria to be taking chest X-ray, and they use their money to do chest X-ray. It has nothing to do with the malaria management, because you as a researcher do not have the money for that study. Then you're exploiting people. You're telling them to come back every day for 5 days. You're not giving them money for their transport reimbursement. You're exploiting them because of their vulnerability. They want to get well. And that's because you did not budget. And so you must budget, and the budget is reviewed so as to respect the principle of non-maleficence. And please note, beyond the protocol, you yourself must behave ethically. Ethics is about respecting the rights of individuals and the collective. You breach the right of one person, you are insulting us as a collective. It's not just a checkbox thing. It's about truly giving back to the society. Doing the right thing. Research is not about you. Research is not about you getting papers and becoming a professor. The research is not about you being the highest manuscript producer. No, it's about finding the answer to a gap that enables us to improve the wellness and well-being of people. Go and check the national indicators around out of every 10, 4 of it is health. 4 of it is what every one of you here will be addressing. And once those indicators are checked, the national development happens. Lives improve. National indicators improve because you are researching to solve a problem. It's about giving back to the society. So research needs to benefit those who participate. And it's about paper and pen beyond that. And in doing that and generating results, you must treat the participants with ultimate respect. So what we are saying is that you must be ethical in your practice. Don't get approval for informed consent and you go to the field, you don't do informed consenting. Don't. It's not about a show. It's about you acquiring ethical behaviors. And what does this mean when we're saying your research is ethical? It's about collaborative partnership. It's about answering valuable research questions. A question that shows social justice. It's about using the valid scientific method. And please don't get approval for a right valid method and go do the wrong. Your sample size is 100. You collect 20, then you multiply it by 5. That is wrong. That's falsehood. You try hard. You do 50, then you multiply it by 2 and say you got 100. That is wrong. That's falsehood. It's about fair study participants selection, about favorable risk balance. Every research has its risk, but at the same time, you must mitigate it. Do not unnecessarily expose people to risk in the name of you chasing the data. Don't ever go for research without getting ethics approval. And don't enroll anybody without informed consent. Once again, do not do this research that will restrict responses. It's not voluntary participation. There are methodologies for imputing missing variables. So if you have missing variables, use the statistical to address the gap. And respect every participant that is enrolled. You as a researcher must have this ethos to guide you. Respect, fairness, integrity, transparency, accountability, and autonomy. I think for the next few slides, you see what it is. Fairness means that you collaborate in a way that you treat each other with respect. Every person involved, your co-researcher, they must be treated with respect. You attribute whatever they do. Give them proper attribution. You cannot be a researcher. Somebody else is working and is not a co-author. Okay? You must show integrity. If you have a grant, follow the rules of the grants. If you say you're going to give your study participant 2,000, you don't get to the field and start say, this 2,000 is too much, it's 200 they should get, and you pocket the rest. Integrity matters in every facet of your research, including the way you interpret your results. Don't tell lies.